Increasingly, physiotherapy is becoming less hands-on, and particularly in the National Health Service, it's moving very much more towards exercise. Here's a sheet of exercises, send you away. And that's not, unfortunately, the only place it's happening. The whole profession seems to be moving away and moving very much towards, oh, manual therapy doesn't work. Well, that's not true. And there is good evidence for the fact that if done correctly, it does improve outcomes for back pain. And there is good evidence for that. And either chiropractors, osteopaths and physiotherapists are all just huge con men, or the power of touch is an important thing. The power of touch has been present since, I'm sure, humans walked the planet. Interaction between people is doing something much more than we imagine, and we could get into the science of what happens when two nervous systems are in the same space, never mind when we lay hands on people. There is neuroimaging to show what happens when we put our hands on people. I agree. I think that manual therapy and exactly what we are doing needs to be questioned. There are many forms of different kinds of manual therapy. They are important. There's the typical manipulations of the spine, of muscles, etc. But many of you might know that I work a lot with myofascial techniques and craniosacral therapy. Now, these are very light touch techniques. Some might think, well, that's not doing anything, but there's no question a patient experiencing that will say, wow, I can really feel things shifting through my body. What about when we're having a difficult time? And sometimes we just need a hand on our shoulder, somebody just to hold our hand. I mean, of course, physiotherapy is more than that, and we are much, much more than mechanical beings. We are sensory beings, motor beings, emotional beings, spiritual beings, and touch. We can't always fix things just by doing the exercise ourselves. You know, I've tried it, and it doesn't work. It's important as an adjunct that people have that involvement going on themselves, but there are countless cases where I've tried to give people the sole management of their condition through exercise, and they only get so far, and then they need that extra manipulation. So I know that there is no doubt that the power of touch, and in all its forms, manual therapy forms, is essential and really powerful in the management of all of your acute and chronic health problems. Hi, I'm Roger. Thanks for watching the video. Hope you enjoyed it. And don't forget to hit the like and subscribe buttons.